Hello again, I'm Jim Raymond with the State Recovery Task Force in the Colorado Emergency Operations Center. In Colorado, the State Recovery Task Force is a collection of state departments and agencies that band together to provide recovery resources as rapidly and effectively to Colorado as we possibly can. Behavioral health is a very important consideration for the emergency management community after a disaster. Fortunately, Colorado has a well-established program to provide disaster behavioral health after a disaster. But it can only be effective if we know how to get help for ourselves and our communities. That's why I've invited Dr. Curt Drennen from the Colorado Department of Public Health and Environment to talk to us about disaster behavioral health. Curt and the team at the Department of Public Health and Environment have made the Disaster Behavioral Health Program a leading program nationally. I've learned a lot about behavioral health as I've talked with Curt, and I think you'll be very interested to know more about this program in Colorado. Dr. Curt Drennen, welcome, and thank you for being here today.
Hey, thanks so much, Jim. I'm glad to be here.
Curt and I are practicing social distancing while we talk, and we want you to be able to hear us clearly. Let's get started by just talking a little bit about what behavioral health is. What do we mean when we refer to behavioral health?
Yeah, that's a really great question, Jim. There's lots of different definitions with regards to what behavioral health is. Unfortunately, we sometimes use it as a euphemism for mental illness. You know, we'll kind of question somebody's behavioral health or mental health. We're really kind of questioning whether or not they're ill or if something's going wrong. But really, our behavioral health is our capacity to address the stresses and the threats in our daily life, whether that's a physical threat, an interpersonal threat, an economic threat. But it's our ability to handle that stress and distress in the moment in an effective and functional way. Behavioral health isn't a dichotomy. You don't either have it or not have it. It's a continuum, and we're all moving on that on a daily basis, if not a minute-by-minute basis.
So disasters tend to trigger concerns with behavioral health that sometimes we need to address after a disaster.
Well, disasters challenge our capacity. You know, disasters are filled with threat, filled with overwhelm, filled with new challenges, and it really challenges our ability to meet those threats in the moment.
So what's the role of the Department of Public Health and Environment and the Department of Human Services in behavioral health?
Yeah, so Colorado Department of Human Services, the Office of Behavioral Health, is the mental health authority for the state of Colorado. And they really manage and support and develop that public mental health, public behavioral health system. Colorado Department of Public Health and Environment, Office of Emergency Preparedness and Response, has a memorandum of understanding with CDHS in order to be the disaster mental health authority, in order to launch programs like the FEMA Crisis Counseling Program.
So during disasters, how do we implement behavioral health?
That's a great question. Fortunately, over the last 18 years, I've been working really intensely with the 17 community mental health centers in order to build their capacity to respond to community need following disasters. And all 17 have these small but very effective disaster behavioral health strike teams.
So we already have community mental health centers in Colorado, and they have components of the disaster behavioral health program that you support.
Absolutely.
Let's talk a little bit about behavioral health in COVID-19 and in this environment. Is it different than a routine disaster that we might think of, like a fire or a flood?
Yes and no, actually. So if you think of a typical disaster, disasters have two real significant challenges to our health psychologically. One is that the disasters, just the chaos and the overwhelm, really challenge our ability to focus, to problem solve, to communicate at times at an individual level. But then that happens in families and even as a community as a whole. But then disasters also tend to, they damage our infrastructure, they damage our homes, they damage our businesses. And in that process, they actually damage the social fabric. So as humans, we're such social beings. when these disasters impact a community and the people kind of get scattered to the four winds, that natural support system takes a hit. And then that has a direct impact on our ability to adapt in the face of the crisis.
So with regards to COVID-19, is there anything different we need to do? And also, can you explain a little bit about what psychological first aid programs we have in Colorado?
Yeah, absolutely. So from a disaster behavioral health perspective, it's really our intention to support people's ability to adaptively cope. What's the word I want to use? We support people's ability to adaptively function in the face of the crisis, okay? So with COVID-19, we don't have the infrastructure damage, we don't have damages to homes, but we have this huge economic impact, and we have this huge impact to our social systems. So we can't go out and join a pickup game, we can't go out and have a beer with a friend, we can't do our normal routines with friends and family,
right.
Whether that may be engaging in a religious or spiritual service, or just engaging in a fun extended family dinner.
For everyday life.
Right. So the actions we've had to take to address the threat of COVID-19 through social distancing, through reducing people getting out and about, that's really torn at the fabric of our community, and people are feeling it hard. That social isolation, that loneliness is hitting a lot of people, and that doesn't even address some of the traumatic loss that's happened. Individuals that have survived the illness, but they've gone through a very scary medical process, been intubated, sometimes even put into a purposeful coma in order to help them survive. And then you've got family and friends that have lost loved ones unexpectedly. And that kind of loss can really negatively impact people's functioning, at least in the immediate moment.
Let's talk a little bit about what's happened recently with COVID-19. FEMA's recently activated the crisis counseling program in Colorado. How is that going to help us respond to the behavioral health challenges in Colorado?
Yeah, so the crisis counseling program is one of my favorite programs as a professional. I've been lucky enough to direct 8 of these over my career. And the crisis counseling program is so unique in that it is very different from traditional mental health services. It's really designed to help a community re-knit back that social fabric, to help people understand the impact of the crisis on their daily life and their functioning, so that they can take active and proactive steps to regain resilience and health and help their families and communities move forward. So we utilize education, we utilize psychological first aid. You mentioned that a little bit ago and I didn't quite get to it. Psychological first aid is this great structure for helping people kind of connect to their immediate needs and what they can do to improve their own health. Again, it's not that they're unhealthy, but it's that continuum. And how do we move in the continuum of health to address all the threats and stresses and distress that is happening because of the event? It's not therapy by any means, but more of a connection to experience, a recognition of strength, an ability to reconnect and re-knit that social fabric for all of our benefit.
As in the emergency management community in Colorado, what should they know about getting access to the resources, and how do they tie into the community mental health network?
There's several ways, and we'll put some links up, but one, and maybe the easiest for all the emergency managers in Colorado, is you're already part of the healthcare coalitions in Colorado, and all the mental health centers are part of healthcare coalitions. So make sure that you just reach out to your healthcare coalition leadership, and they can connect you directly to the mental health center in the community. But also we have this great behavioral health map that we'll have a link on as well. You can click on your county and it immediately identifies the mental health center for your county and the connection, the email and phone numbers in order to connect with the disaster coordinator in that county.
That'll be terrific. So in terms of this disaster, the resources are there. So now it's a question of connecting those resources, and the crisis counseling program will actually just provide even more resources for Coloradans. Is that right?
Exactly. And you know, where the traditional behavioral health system is really designed to meet the needs of people with serious and persistent mental illness, or people that are actively looking for traditional services in their community, traditional therapy services. The crisis counseling program, while there is that crisis counseling component, really is a resilience-based program to help people recognize and address what has impacted them because of this event. And this event is impacting all of us. There's no person that's untouched by this COVID-19.
Well, another thing that's come to mind, and we've talked a little bit about this isn't just the disaster survivors that are having behavioral health concerns. This is healthcare workers and first responders and emergency managers, and this is really all of us.
Yeah,
and
exactly.
So this really is a large scale issue, and I'm really glad that you and your team are working behind this to really provide these resources in Colorado. Is there anything you want to say at the end to the emergency management community that you think they should know?
Yeah, I think just know that we've just been awarded the crisis counseling program, and we've got to go through a process of getting it up and off of the ground. But this will be a recovery resource that will be available to us for the next year. And should we have other waves of this pandemic, there's a possibility it could even be extended beyond. So this will be kind of a long-term recovery resource for the emergency management community, the public health community, our communities as a whole.
Well, thanks so much for your time today. I really enjoyed talking to you. I'm glad you were able to be here.
Thanks for the invite, Jim. This was wonderful.
Okay. Thank you, everybody, for watching. And we just want to give a special acknowledgement to the emergency managers, the first responders, the healthcare workers, and the essential workers that are really keeping Colorado moving.
Absolutely.
Be safe and be well.